PainBytes is a podcast that will explore the lived experience of pain, especially those aspects or parts that have helped to overcome pain and see the light at the end of the tunnel. Today, I am having a conversation with Brett, and Brett is someone who's had a significant pain experience. He's lived with pain for many years, with chronic pain, and he now works in a field helping people who suffer from chronic pain. Welcome, Brett. How are you doing today?
Hey, all good. I'm good today. How you doing?
I'm good, thank you. So, my first question for you is, just to give everyone a context of where you were when you started this journey of recovery, can you just explain to us what it felt like when you were in that place where you thought, this pain is not going to get better. It's not going to go away. I'm feeling hopeless. I'm feeling helpless. I don't know what to do. That point just before you started your journey to recovery where you thought, I'm lost. I'm in that dark place. How can I get out? How can I find a way out? If you could just explain to us what that felt like, just to give some context to how significant your pain experience was at that point.
Yeah, I think it was. I think the one word that really sums it up is scared. I was really, really scared to be this young. And I think I was what, 26 at the time. To
Wow.
be this young and
Yeah.
have to experience just day in, day out, get up in the morning, there's pain. Um, so it's that fear, but the longer that it stays, you lose that hope of it's going to change, and the
Yeah.
fear just spirals out. It's you can no longer swim, you can no longer run, you can no longer go to the shops and just pick up a basket and put milk, and it was starting to affect relationships. It was starting to affect um, work, obviously, and that sort of snowball effect of just there was just so much isolation. I think it was my problem. No one else truly understood it. You tried to speak about it, no one wanted to hear about it. You went to numerous people. I tried every person, Chinese medicine, you name it, I did it. And they didn't get it. They didn't understand. They so I guess that feeling of just absolute fear that this is going to be the rest of your life, and is it worth it? Is it worth it to suffer
Yeah.
through this? That feeling of loss of shit, will I ever be able to run 21K again, or even just run on the beach, or will I be able to surf again? Will I be able to do the job that I'm trained to do? What do I have to do? I've got to start again.
Yeah. And that's absolutely a scary place. I mean, and I hear that from many patients often, but also a very lost place, right? So you're lost. It's almost like you're in the middle of a desert or the ocean, and you don't have a life raft, and you're thinking, how am I going to get to that shore? How am I going to get there? I know where I want to go, right? So you knew where you wanted to go. You knew what you wanted from your life, but it just almost felt too far away at that point.
I think you become so focused on the things that aren't going right. You can have five good things happen, but one bad thing outweighs all of them. A
Yes.
block or just a bad conversation and the world
Yeah.
spirals out. Or that HR phone call, come
Yes.
in, we need to
Yes.
talk
Yes.
about,
Yes.
your back.
Yes.
Um,
Yes. Yeah.
and that just spiraled everything out. That was all you saw. It's a tunnel vision of so you can't see the shore. You can't, or you have an idea of what the shore looks like. But no
Yeah.
matter how you try and get there, there's all these waves hitting you, if we're using that metaphor,
Yes.
that you're just actually being pulled further out every time.
Yeah.
And then you have to think, shit, I've got to find a new shore.
Yeah.
I've got to find a new shore. And it might not be a beach, it's probably just some rocky outcrop somewhere out there.
Yes. Gonna take whatever I can get at this point, yeah. So you kind of like have to, in a way, it's about expectations, right? You have to start managing your expectations of, okay, so if I can't get to the shore, Is there probably some kind of rock island thing out there that I'm gonna be able to see in the distance that maybe I could get to, it's almost like you negotiate with yourself, right?
I think, yeah, you definitely negotiate, but the logic of what you hang on to doesn't make sense. You know, a small little stick floats by and it's some acupuncturist who's promised to take your pain away, and you jump
Yeah.
on that, and that's all you hope, and then again you shut down because that does nothing.
Yes.
Or
Yes.
um, you, and each time that happens, you lose more and more of yourself. So you're accepting less, you're expecting less of yourself. Um, and you just get to a point where you just chuff to get out of bed. That's it. That's the best thing I can do today is I can get up, I can make myself breakfast, and then I can get back in bed. And I did a great job.
And that's a
And
win.
then, yeah, well, it's a win. But when you realize how small it is compared to where you were before,
Yes.
that's depressing. And that's when you get to that, I'm useless. Something's wrong with me. And you start to blame yourself. This has to be me. This has to be me. What am I doing wrong? Horrible, horrible space.
And so you were in this horrible space and suffering from pain. And what changed? What was the thing that changed? What was floating that you got on? I'll almost say there was something there that you actually, at this point, made the difference. It was that first step, you know. Yesterday, in my previous episode, in the previous podcast, we talked about the climb, because it's not just a walk. This is not a walk out of pain. It's literally, it feels like a climb, right? You've got to really struggle. Every movement you make to get out of this hole, you're climbing out. It's not easy. This is not an easy journey. So what was that first moment? What was the thing that happened?
I think I needed to let go. I needed to let go of the idea of what felt this preconception of what needs to be done. You know, I'd been seeing doctors that weren't my choice. I'd been seeing people at clutches to try and figure it out.
Yes.
I was holding on to a job and feeling so unjust that they didn't hear me, that they didn't see me, and they weren't supporting me. And the moment that I let that go and said, well, actually, what am I fighting for? All these things that are actually making life so much harder. Why am I fighting for them? And I need to let go of this idea of what life should look like and be open to what it possibly could be. Maybe I don't know what that is. But whatever is happening in me, it can't, this tunnel, the sea, this climb or walk that I'm on, it's not working. Something's not working, and it's just messing me up even more and more and more. Something has to change. And I stopped fighting. I stopped fighting with HR. I stopped fighting with the doctor, with my manager, with my family, telling me what I should do. And I said, okay, cool. Fine. I'll move back home. I'll do what I got to do. I'll find another job, one that works for me.
Yeah.
That letting go was the first step, I think, to focusing on actually what I wanted rather than what I felt I needed.
And that's such an important step. I think that's crucial. If I think to, the patients that I have treated, the people that I've helped with pain, I often find that they hang on to what they consider inverted commas, because I mean, normal is relative, right? But they hang on to normal. They hang on to what their life was before pain, because that's what you know. I mean, that is who you thought you were or you are, and you're kind of going, I want that back. I want that person back. That person that was fun, that was doing sport, that was going out, dancing, that was working hard and was being recognized for things. I want that person back. I don't like who I am right now. It's got a little bit to do with that as well. It's the fact that you've become someone that you yourself feel like, I don't like this person. I don't want to be here. I don't want to be this person. I want to be the person I used to be. And it's exactly what you said in the beginning. It's about that loss, right? That you've lost who you were. You were so much, and now you feel like you're less. So I think it's crucial, this thing of letting go. And I think many people struggle with that. I mean, at least in my experience in treating people with pain, they struggle with letting go of the idea that actually I can have a future, but it's going to be a different one from the one I thought I was going to have.
Exactly. Surrender, I think.
Yeah.
Surrendering to
Yeah.
this is the new normal. And that's
Yeah.
okay. And that's
Yeah.
okay.
And that's
Maybe
okay. Exactly.
accept,
Let's say
accept.
that again. That's
Yeah,
okay. Surrendering to the new normal, and that's okay. So I
yeah.
think that's a very powerful statement, Brett. Thank you for sharing. That's really a powerful statement. Okay, so then if we think along those lines, what do you think were the top 3 things? And these can be tools, strategies, milestones, people you met along the way, whatever it was. What were
Mm.
the 3 things in your journey of recovery that made the biggest difference in your pain experience that you can say definitely helped you to overcome and to thrive again?
Yeah. It's a tough question to tie it up, all these
It
years.
is. It is.
Um, I think the easiest one, right, is curiosity. Staying
Yeah.
curious.
Yeah.
What's happening? What am I believing? Right? What am I believing? What am I bringing to the situation? How could that be contributing to what's going on?
Yeah.
What is my expectation of what other people could bring? And what else can be done? What else is out there? So the moment that I stepped out of what I thought pain was, what I'd been trained in pain. I knew what
Yes.
pain,
Yes.
I knew what patients needed. But the moment that I stopped and said, shit, Brett, maybe you don't know
Yeah.
everything. Maybe there's a new way to look at this. Maybe there's something else. And then
Yeah.
I started to research. And I'm not talking about WebMD.
Yeah.
I was looking at, okay,
Yes.
cool. How can I learn more about this? How
Yes.
can I interact with people going through this?
Yes.
And I'll never forget the first time my physio said to me, I think you might have chronic pain. And I was like, no, no, lady, you don't get me. This is not chronic pain.
Yes.
Fix my spasm, fix my back, like push
Yes.
on me, right?
Yeah.
And then the curiosity of when she did that, and it made it worse.
Yes.
And then I was in spasm, and I'm lying on the floor trying to feed my cat, and I'm in spasm crawling to bed.
Yes.
What's going on? Why does this not make sense? Why do the treatments I know in my head should work? Why do they not work? All right.
Mhm.
So that curiosity, but it had to shift from just gentle curiosity to a little bit more focused, but observing that my curiosity often would go to something's wrong, something's broken. They've missed something. They left something in, they botched it. So curiosity turned to blame, and that then had to turn toward, okay, but then what? Then what? We've done another MRI, there's no botch. Something's not right, and I need to figure it out from there. So that's number one. Sorry for the long.
Yeah.
The
And
long.
that circles that actually it's interesting because that circles back to the letting go, right?
Yeah,
So the curiosity in the end led you back to letting go again, letting
yeah.
go of these things that you were holding on to that in a way were holding you back.
The curiosity then led to the scientific reasoning, right? Of what else could possibly be happening and how can I test my body, right? So I know that I used to love running. That was big passion. So what if I went for a run? What's gonna happen, right? Went for a run, full spasm. Okay, shit, Bridge, you went 5Ks today. Okay, that was probably too much. Let's do a walk/run. And I would start to test these little things. Try, can I swim? Can I run? No, my body doesn't like that one. Okay, cool. Let's go back to yoga. Definitely doesn't like that one. Right. Go to gym, do some strength training. Okay, wait, hold on. That's okay. So you craft this little recipe. And I think that became my second safe space, or my second change, was creating my own routine, finding out what my body was willing to do, work with, what's my baseline now, and crafting it. So, okay, I know I need to meditate in the morning on my back. I know I need to spend 10 minutes imagining going for this jog, going for the jog, right? Sitting down afterwards, having some water, lying down, right? I had to craft it carefully. And then I would start to play. Okay, cool. What if I missed the meditation? What would happen? What if I missed this? And then you could start to see what was working, what wasn't working. And that then led me to now trying to understand. And that was probably the third thing, was to never stop seeking knowledge. Never stop. When you get the bad news, when you get someone who is disbelieving or invalidating, or you go to that physio and he's like, there's nothing structurally wrong with you, I've seen your MRI, you can definitely just pull a finger and say, up yours, buddy, I'm going somewhere else. To not let the external affect my internal. And that was the hardest lesson, is to keep that inner light. Okay, only I can move forward. Right, keep going, keep going. Don't let this bring you down. Don't let this bring you down. And when there were downs, accepting again that that is okay. That's it.
Yeah. So it was a journey of letting go. There was some negotiation with your body and your mind about what works, what doesn't work, and then full circle back to accepting and letting go. So that's a big part of your pain experience, is the letting go, the accepting, because without that, you can't move forward. You can't become unstuck. And I think that's quite important. Yeah. Really, really important. Thank you so much for sharing that. Now, I want to ask you, so the big reveal that we haven't said yet is that you're a physiotherapist. So you are a physiotherapist and you treat many, many people with pain. I mean, I feel like in physiotherapy, 80% of the people who come to you probably have pain, whether it's acute or chronic, they have pain. So how has and you had quite a significant pain experience. I mean, you have chronic pain, you live with pain every day, you manage it, you've overcome it, you're living a life on, with purpose, with meaning. But how has your pain experience, everything that you've suffered through and gone through, how has that changed how you interact with your clients and patients now, as opposed to how you were doing it before you had this happen to you, before the experience of pain and before you recovered from it? Yeah, it's going right there, right? It's right there. It's like, what is the thing? What is the thing that changed?
The thing that's
I'm sure
probably
there's lots that's changed, but like, what is the thing that stands out for you?
the biggest thing would be validation, that the most important part of this interaction is this person in front of you being heard, feeling safe. And with that means, again, letting go of what I think this person needs and letting them drive, really, what do you think you need? And of course, we have such egos, right? And we have such our own experience of, well, I want to tell you about my pain. I want to tell you what I did and what worked for me. And this has to work for you, right? You just got to let go of that threat response. But when you can stop and just let someone say their piece and really hear them, really empathize, half the work is already done.
Yeah,
Right.
I agree, because they feel heard. Yes, you, if you were the patient, feel heard. someone's listening, and they're not just listening, they're actually listening and hearing me. They're hearing my pain, they're hearing my suffering. They want to help me, but they want to help me in the way that I want to be helped. And I think that is something that is missed often with healthcare professionals. We miss that one piece of the puzzle, right? We miss that one thing that our patients are looking for, and it often is the fact that they're asking for X, but we want to give them Y because the research says that Y works. You know, all the evidence, all the everything that we've been taught at varsity says that Y works. So we will give you Y because Y works, right? But the patient's going, I don't want Y. I'd like X, please. Can I just have X? So are you finding that it's easier for you to give them X?
I find honest that people don't, I don't know if it's the system dish or what it is, but so many people arrive and are willing to accept what we give without actually saying, I want X.
Yes.
And even trying to ask them, what is it
Yeah.
that you picked? What do you want? And they'll say, I don't know. I'm in your hands. You're the guy that I need to see. I've heard this one told me to come see you. You're the person.
Yeah. 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 Yeah.
And it's almost like not buying into that and saying, you're the expert. You are the expert. You know your body way better than I can ever pretend to know. I can listen and interpret what you're saying and give you some ideas. And whatever my journey has taught me is that even knowing about pain and learning about pain and studying pain, it still took me 2 years of knowing pain to truly accept that I was that patient that I'm learning about. That my pain was predominantly stress related, it was security related, it was safety related, it wasn't physical. But I was denying that for so long. So when this person comes, it's listening, validating, letting them try and run the show and saying, these are the options, but understand that that process takes time. It's not going to be solved as you sit there in this 45, 1 minute, 1 hour session. It's not going to be solved probably by session 3.
Yeah.
It's a journey. And it's tough to let go of that ego, right? That,
Yeah.
hey,
That you
Desh,
can
I
help
think
someone.
you need
Yeah.
a TENS machine. You need Botox, right? You need something.
Yes. Yeah.
It's
Yeah.
so hard to try and to stop trying to fix, because that's what we've been taught.
Yes. Because as therapists, that is exactly what we've been taught. We've been taught to fix, to solve problems, to help people, you know, but there's different ways of helping. And in chronic pain, there are very different ways of helping. You can't do what you do for someone who's in acute pain. So yes, I definitely agree with you, and I think that you're right. That is that keystone of your treatment. It is the foundation with which you cannot build treatment. So if you don't validate your patient or client, if you don't almost live their experience with them, yeah, if you don't do that, you can't truly help them. And I mean, and you know this, some patients will take 3 months and then they're on their way.
Yeah.
Some patients will take a year. Some might take 2 years. Because I feel it depends on how big that hole is.
Yeah.
How deep are you underground? You know, what are the other external factors that are affecting your ability to climb out of this hole? Because we all know that it's not as simple as just you. It's also about the support that you're getting. It's about whether you have employment. There's all kinds of things that come in and affect our experience of pain.
Holding that space. And I think being okay with them leaving and coming back and being okay with them saying, I'm going for this hip replacement. I've decided
Yes,
this is what I
this is
need.
the way. Yes.
And then when they come back in 6 months and they say it did nothing, okay, here we are.
Yeah.
Tell me about it. Tell
Yeah.
me, where are you at?
Yeah. So it's also about being patient.
And that's the
So
hard part.
actually, and that's hard. That is really
That
hard. Being patient with your patients or clients and with yourself, like kind of going, okay, I know that this is the wrong step. I can feel it. It's not going to help. It's probably going to come back and it's going to be worse. Not even the same. It might be worse, but again, it's that letting go, right? It's the letting go kind of, that's your journey. It's your journey. So you're going to walk it however you want to walk it. And it is what it is. Absolutely. Agreed. Yeah.
until someone is empowered with, you can give people options and you can tell them what to do, but unless their decision, unless they own this journey,
Yeah.
it's going to sit on the top, but it's never going to sink through. Right?
Yeah. True.
Um,
True. Thank you very much for sharing your experience and for all of your wisdom. I am going to say wisdom because it is wisdom that has come through your pain experience and your recovery journey. So we're going to end off now, but before we finish, I give everyone a chance to kind of say if you want, people to contact you, do you want to give your details or would you prefer them to just contact me? Because I'm going to give my details now if they need to get a hold of you.
yeah, I'm open to anyone reaching out.
Yeah.
Probably an email is best.
Yes.
I'm
Yeah.
not sure.
So what I'd like to say, my email address is info@paincoachsa.co.za. And so if
Yeah.
anyone would like to talk to Brett as a fellow patient, colleague, if you just want advice or you want to hear more of his story, absolutely mail me and I'll give you Brett's details. But thank you so much for your time. I really appreciate your authentic sharing of your pain experience. And yeah, we'll chat soon again.